So hi, I'm Katrina, CEO and co-founder of Microvention, also a member of Health Founders Estonia, and really happy to start with the good news. Today we have 3 panelists here, excellent experts of health tech and innovation, but I'll let them to introduce themselves. Sigrid, word to you.
Thank you, and it's a pleasure to be here. I will have to elaborate a bit what was said in the introductory words, that yes, I'm very proud that Estonian government has decided to incentivize innovation via public procurement as well. So now we have these percentage goals that we are going to pursue, and I'm sure that the health tech and medtech area will benefit from that as well. But a few words about myself. I work for the Ministry of Economic Affairs and Communications, and my daily job is to make sure that companies have the possibility to invest into R&D and innovation. So we take care of different kind of grants and programs and up to financial instruments, fund of funds and stuff like that. And technology and domain-wise, there's space policy, there's CERN, there's startup policy, deep tech, and I mean a variety of domains. But the overarching aim is to make sure that we have a good place for innovative companies to be born, to grow, and to raise capital, to attract talent, and etc.
Thank you, Sigrid. Joseph, how would you introduce you in 1 minute?
Oh, let's try. So I'm Dr. Joseph McAnu, co-founder and managing partner of Verge Health Tech Fund. Personally, I've been very lucky to have worn a number of different hats in my life. First as a coder from the age of 6, making video games, then a scientist, then a management consultant, and now an investor. Verge itself is a very rare beast. It is a global health tech fund that invests all the way from first capital all the way to pre-A, A-ish, in technologies that can really move the needle globally. And what that means practically by investing globally is that we invest in solutions that may be born in a place where the need necessarily isn't. So we have invested now in 21 different countries, but we see them active all around the world. And we think that Estonia exemplifies this philosophy, and I'm honored to be here today. Was that a minute?
Yes. Thank you, Joseph. Andy, your connection with Estonia is very strong, but you're a global entrepreneur and investor. Could you introduce yourself?
Sure, I'll try and do that. You can probably tell from my accent that I grew up in Texas, but I've lived for the last 35 years in Silicon Valley, actually right by Stanford University, right in the middle of Silicon Valley. I've been a healthcare entrepreneur and investor all that time. I've had the incredible good fortune to start, build, and exit 4 times to Fortune 50 companies. So that's been a good run. I've had plenty of other opportunities to have my head kicked in, and that's probably where I've learned the most. In fact, I would say I've learned so much by having my head kicked in that I'm now an expert. So that's my professional life. I'll just mention on the side, for about 20 years I've been on the board of Stanford Libraries. You might scratch your head and say, what's that got to do with anything that's to do with tech or life sciences? Well, it turns out quite a lot. Stanford Libraries is known as the juggernaut of digital innovation in academia, and the amount of work that they've been doing on digital programs is quite astonishing. I just let you know that at Stanford Libraries there are 500 people on staff and 250 of them code. So it's an incredible platform. I'm a founder of something called Summit Schools, which is the largest tech-enabled learning platform in the United States. So lots of different things there. Katrina kindly mentioned our connection to Estonia. My wife's mother was Estonian. She escaped in 1944, got to the US in 1949. We have more relatives in this country than anywhere else in the world, maybe 60 relatives in Estonia. When the country became free in 1992, Sylvia's mother wanted to help rebuild, and she was a passionate Estonian. And so we have a family foundation, it's called the Kisler-Ritso Foundation. It invests specifically in the cause of freedom, and more specifically in the cause of freedom in Estonia and related regions. And we've been doing that since 1995. If you want to know what that might look like, some of you may have seen a film called The Singing Revolution, and if you've seen that movie, it's a great movie. We funded that movie. Some of you may know about a museum and exposition in Tallinn called Vabamu. That's something that we created and fund. More recently, we brought to Estonia something called the Creative Destruction Lab, and if you know anything about that, then that's something where Vabamu is the lead sponsor, and I'm the founding member of CDL Estonia, where I'm on the board. So lots of different ways in which we come to Estonia to interact with Estonia and help Estonia. And what I generally tell people is that what's important about this country is that it's the eastern edge of the Western world, and if we don't keep it free and we don't defend it, we'll be defending the White Cliffs of Dover. So it's actually very important.
Thank you, Andy. Now we're ended with the introductions, and you really see that we have the experts in the panel. I would like you to also ask the questions, so be aware of this Votimu app. The code is on the wall, and ask a lot of questions, so we can ask them from the panelists also. But I would like to start the conversation here now with the question that Sigrid pointed out in the very beginning. The government made a huge decision to invest even more into healthcare. But what makes Estonia uniquely positioned to do the digital health and do the digital health move?
Well, I think it doesn't come as a surprise to anybody that we as a digital nation, we have this very strong base to build any kind of tech upon it, be it health tech or any other kind of tech, defense tech, among other things. So that's a strong base, and we have to be clever how to make the most of it. We have good examples. I mean, e-prescriptions, the medical database, so there are things there. And another advantage we have is being, not saying small, but being compact. So we as a country are very compact. I like to think that we are lean as well. So we are able to make decisions quickly, because healthcare system, I mean, it's very regulated, and it can be quite conservative everywhere in Estonia as well. But we have these advantages that we can make the most of it. Now, what the government can do, I mean, not only procurement-wise, but we have the possibility to create this kind of testing bed or living lab space here. So we have this very vibrant startup ecosystem as well, and we can use it. And I'm sure that there are founders and investors looking into ways how to elevate it even more. I know we are looking at it from the government perspective. When I mentioned deep tech developments, we are not choosing any verticals there. We are just making it available for any tech to emerge.
Andy, would you be so kind and comment how would Estonia be the winner in that race for digital health going global?
One of the things to really note about healthcare and life sciences, but it's also true for any industry that's heavily funded by government, is that incumbency is a huge problem. And one of the strategic advantages that Estonia has with respect to innovation in this sector is that it's not a country that has a well-established or scaled set of incumbents. So, as a small health system, that's probably easier to change and adapt than the kind of health system that you might see in the United States. Doesn't have a large pharmaceutical industry, doesn't have a large biotech sector, doesn't have many of the things that would be significant barriers to innovation that you might find in the United States. It does have one big disadvantage, and that's called EU regulation, which in my view is crippling and is a very significant problem, and something that Estonia can perhaps help change, because US regulation around digital innovation is actually much more forgiving than it is in Europe now. And I think just in general, European regulation on things like AI is frankly guaranteed to ensure that Europe will never be a leader in those sectors, and that's something that really needs to get addressed.
Joseph, would you care to comment what would be the limits of your portfolio companies in Estonia or in EU?
Sorry, the limits?
The limits and the options also.
All right, so I would see Estonia as a very good pilot environment. And the nice thing about, I guess, the Estonian philosophy, at least from my understanding of it, having come here a dozen odd times in the past decade or so, is there's this nice balance between data security and data ownership and the ability to kind of allow the end user to have a meaningful participation in this process, which I think is a nice exception within the other markets which tend to have a lot of accessibility to data, which is basically the government's philosophy is we own all the data, we do whatever we want with it, and we bestow you the honor of analyzing it. Whereas here, it's a nice system where you have transparency, you see who access your health records, and you have the option to opt in. And because you have a digitally native population, you actually have, theoretically, participation rates that would be higher, and I think it's done in a philosophically aligned way that would be compatible with the rest of the European Union, Latin America, and maybe parts of the US and maybe the UK as well. And I'd love to be challenged and corrected on this as well. I see it as a lovely pilot market. I don't think you're going to come here to make money in Estonia unless you're able to reach all 1.3 million Estonians in a meaningful, as in over $100 per person per year type of way. And I think that's exceptionally difficult. So I'd really see this as a lab or as a proof point to then access the rest of the European Union with.
Very much agree. We have a question from the audience, actually, and it's very important in the healthcare solutions field, how to incentivize healthcare providers to do the clinical pilots and be actively involved in innovation.
I'll just lob something in here. Look, we don't have a healthcare system, and this word is extremely misleading. We have a sick care system.
Yeah.
Yep.
It was built in the last century to deal with the problems that we mainly had in the last century, which are acute disease and trauma. The problems we have today are mainly chronic, non-communicable diseases, and they're not well suited to being managed in a sick care system, and they never will be. And so one of the things that's important to understand here is this isn't a quote about persuading healthcare providers to do something. It's about actually empowering and engaging consumers to do things for themselves. If you think about the incredibly powerful impact of the digital revolution, then it's about shifting the world from building, people, product, professional, to mobile, software, service, consumer. That's the run, right? So the innovation in financial services is not getting bank tellers to do more stuff for you. The innovation is you on your mobile doing it for yourself. And that's a very, very important distinction. And my advocacy would be, we don't need to get the sick care system to do healthcare. What we need to do is to say, it's great, we've got a sick care system. We need to build something to complement it, called a healthcare system, making use of the very best technologies that we have today. And it will look very different.
So the question on that one is, currently most ministries of health are kind of, well, it should be Ministry of Sick.
That's correct.
Yeah, so the policy needs to actually promote the creation of public health agencies that actually have some teeth and actually have some budget behind it and actually have some standards by which you can say, okay, we're going to have a data infrastructure by which all these preventative diagnostic and screening mechanisms can now plug in. And I think in a lot of countries around the world, you simply do not have this. And maybe that's the opportunity for Estonia to actually say, you know what, we're going to invest very much into this public health type of policy that will promote monitoring and prevention pervasively everywhere, given that we have mobile phones, we're all in our homes, we're in schools, in the workplace. Sitting here with the right equipment, with the right camera, you can actually look at subtle coloration differences in my face and infer my heart rate, infer my blood pressure, my stress levels, whether I'm arguably telling the truth or not, microexpressions and whatnot. So there's a lot of data you can actually passively get, of course, with the appropriate privacy and governance mechanisms in place. So there's a lot we can do, and I think this might be the place you can do it with.
Yes, so I just want to echo, we're sitting next to somebody from the ministry. The innovation that's required is not technological, it's legal, regulatory, and reimbursement. Those are the core innovations that I think.
And behavioral.
And
Well,
behavioral,
yeah.
definitely. But before changing
Hold that
the name-
thought, and I'll come back to you.
Yeah.
But before changing the name of the ministry, Sigrid, what would be the 3 things that we actually could do?
I don't believe in totally top-down approach. It doesn't work. I mean, I can bring a parallel from the education area in Estonia. For instance, we know that we've been missing these ICT professionals for years and years. And there's this coding code in the eastern side of Estonia, Jõhvi coding school, if some of you have heard of it. And it was totally bottom-up initiative. So it was founded by previous and existing startup founders, investors, and then the government came along. But the initiative came from bottom-up. So I think the same is necessary in this either sick care or healthcare system. So if there's like clear bottom-up, very good initiatives, I'm sure that the third sector and the government will come along. This doesn't mean that the government or the sick ministry or the healthcare ministry doesn't have to do its job, but I can't speak on their behalf. They have to do it, but I can't see any other way. It has to be in combination. It sounds abstract, but it has worked before.
Yeah. Can I ask a question?
Yes, of course.
So the one challenge with health is that you know the components of health. You know, the medical system are only responsible for 10% of our health outcomes. Behavior is 40%. Environment is a certain percent. Socioeconomic status is a certain percent. And behavior encompasses how you move, what you eat, how you believe, you know, how you think. Optimists live longer than pessimists, that sort of thing. How would you do a bottom-up approach with something that is so multifactorial when you have to engage, you know, the technology side of things, the food lobby, you know, general, I guess, health education and healthy behaviors? I think it's just enormously difficult. And I don't know the answer, and I don't know if anyone has any thoughts on it.
Yeah, so there is a huge body of literature around behavioral science. And so it's very disappointing to me that people in healthcare and life sciences wring their hands over this when everybody else who wants to sell cigarettes, fast food, and you name it, has figured it out. And so, look, it's about time that we realize that there's all kinds of things that you can do that are very simple to affect human behavior: measurement, feedback, nudges. These are all proven techniques. And you can start with very simple interventions that will help people. We also know that we tend to heavily discount future risks too much, and we tend to heavily overvalue current benefits. And so there's all kinds of ways in which this can be actually manufactured. One of the stories I'll tell here. So a few years ago, there was an initiative in the United States. It was Berkshire Hathaway, Amazon, and JP Morgan Chase. And they were going to transform healthcare. And so I got invited to a meeting with the management team of that initiative in the JP Morgan headquarters in New York. And they're all saying, oh, behavior change, it's so difficult, you can't do it, blah, 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 blah. And, you know, consumers, people in healthcare, they're so naughty, they won't take their drugs, on and on it goes. Okay, so I eventually just said, okay, why do you think Jamie Dimon is closing all his bank branches? What's going on there? Okay, so what he's doing is to move his place of business from his building to your mobile. And what he's doing is to take his very complicated financial products and simplify them so they can be task segmented and put on a 5-inch screen so that a low-income person during their lunch break, sitting on a pail by the side of the ditch that they're digging, can actually get a mortgage. I'm asking you a very simple question here, people. Is this the consumer being forced to change their behavior, or is this the bank changing its behavior to meet people where they live, work, play, and pray in ways that they can see, measure, and understand? Answer, it's the latter. And the problem in healthcare is not that it's difficult to change consumer behavior, it's difficult to change professional behavior. That's the problem.
And definitely I agree with Andy on that. Talking to healthcare providers every single day, we just have to give them superpowers to help in the current sick care system, but also change their behavior during helping the patients and changing the patient behavior also. We have to take more responsibility on our own health. Estonia is a digital country, has been that for a while. Sigrid, what are the components components for success of Estonian digital health companies currently? What do you see?
What are the competencies for digital
health companies in Estonia?
Well, that's a good question. The digital skills are like the hygiene factor. I would say that there's no argument about that. I very much agree what you said before, that the healthcare providers need to be somehow incentivized. So I see that if there is a universal answer, it probably would have been out there already. But I see that the main competence lies in understanding the system, understanding the flaws in the system, understanding the possibilities in the system. Because, I mean, everybody can see the flaws, but how do you turn the flaws or the downsides into upsides? And I mean, that's a clear competence that's necessary. And I don't have this competence, just saying, but otherwise you can't innovate. Yeah.
Joseph, Andy, you both have definitely seen several good examples in your portfolio companies. Who to succeed?
I think it's really understanding what business model is appropriate, what stage of development the company is in. I think that with a lot of digital health companies, and again, I'm going to speak in generalities because there are 10 times as many healthcare problems as there are digital health companies out there trying to solve them. But generally speaking, there were attempts at trying to do this consumer way, but consumers don't like paying for things. And there was this illusion that they would be by the provision of easy money of the 2019 to 2021 era, which I think created a bit of a bubble that was crashed. I think what worked really well is when you're actually clearly defining the type of disease or state that you're trying to prevent, monitor, or treat, and then obtaining as much clinical evidence and economic evidence that would try to prove this to both benefit patients and the health systems, and ideally not encumber or impede the providers. I don't know if I'm answering the question as it was attained, but in order to obtain that evidence, it's not cheap. And generally speaking, you would always want to go after third-party payers or investors, if you have access to them, to generate that first body of evidence. And typically that has been in pharmaceutical companies that are trying to find out how to avoid the disruption of themselves or find out how to better target their medications to prove health economic value. And then once you have a critical body of evidence, then you would get someone who's actually responsible for paying the health system, be it public or private, to then pay the bill. I generally, and this is my own bias, I shy away from anything that requires a consumer to pay for anything.
Okay, so here's where I'll sort of frame it. If you're going to get to scale, from a healthcare or life sciences perspective, you've got to get to the US. The US business model is very, very simple. You have to today drive sick care revenue. So the producers, the providers, the politicians and the payers all want healthcare to cost more. Don't believe a word of it when people say they want it to cost less. It simply isn't true. If you look at US healthcare spending, it's been growing at 3% above GDP growth for 60 years. That's a hell of a trend. And so this is a place where stated preferences and revealed preferences are wildly in conflict. People want revenue. The only people who would like US healthcare to cost less are patients. But to quote one of the leaders of the world's largest pharmaceutical companies who whispered this into my ear at the World Economic Forum in Davos, patients, unfortunately, are not part of the business model. Okay, so that's a grim reality, and it's worth just noting. Let's come to how we might make patients part of the business model. You alluded to this question of economics. What we have is a sick care system with trillions of dollars, 7 or 8 trillion globally, going into sick care, which governments underwrite. And they typically have annual budgets, and they pay enormous amounts of money to care for strokes and heart attacks and dementia and life care and goodness knows what, right? And all of that's underpinned by the kind of studies that you're describing, which are the economics of sick care. we don't have any economic models that look at the economics of healthcare and preventing those things. And by the way, what's required is someone to allocate a budget into that kind of system, real dollars out of sick care into healthcare. And what we need is the kind of mindset that underpins our attitude to climate change. So when you talk about a climate investment, nobody says, you know, before we do that carbon capture thing, or before we do that alternative energy thing, we need to do a study for the next 20 years to see if it's economically viable. They say, we need that because we have an existential threat. Yeah. Okay, it's absolutely the case that if we don't start to actually invest in healthcare, we are going to have very large populations of very old people who are all gaga. They're all going to have dementia because we already have a 15 to 20 year health span gap. So this is not that hard to figure out if you can actually reallocate the dollars that we currently spend on caring for people who are 75 or 85 and can't remember what day it is, and actually say, let's take some of that money and start to invest it in the kinds of behavioral change and engagement techniques that we know actually work, because that's why people smoke and eat fast food.
Yeah. You know, it's interesting. I heard a fun anecdote from somebody who left an industry to start a company.
Yeah.
Life insurance actually is the only commercial stakeholder that would be interested in this, but they are legally forbidden from intervening.
There's a whole bunch of legal and other questions you could ask. Again, let's go back to behavior change for a second. If you just think about insurance, because this is a good analogy, in the United States, there's only one insurance company that makes money out of insurance. It's called Progressive. They actually seek out bad drivers. All the other insurance companies that insure you for driving seek out good drivers. They make all their money on float, right? So they lose money on the actual insurance business, but they make money by investing. Okay, that's their business model. How does Progressive do it? Well, they seek out bad drivers, and they do that by actually giving good drivers crappy quotes, so they go to Geico. And then what they do is they offer them things like a dongle you can put in your dashboard, where they will give you measurement and feedback with respect to how you drive. And they'll see whether you run a red light, or whether you roll a stop sign, or whether you go too fast, or, okay, so they're measuring your driving. Measurement, then feedback, so then they're going to tell you how well you're doing and what that means in terms of how much your insurance is going to cost. They do that for 90 days. And after 90 days, their math says that by then, you either are still a bad driver, or you will have become a good driver, and they know exactly what it is. So look, this is a company making money using very standardized behavioral science to cause behavior change. So, okay, we should be doing it. And the insurance industry would be one that would be very good to do it. Yeah.
I think that was a very good reflection, but I would like to have a reflection from Sigrid. Before we all go gaga, as Andy said, would Estonia be able to invest in health, not in sick care, but in preventive healthcare? And what would be the options?
Well, as you know, the government is looking for millions and billions to cut back. But my answer would be definitely yes. Well, actually, it's like a necessity. We don't have a choice, I would say, because otherwise, in the long term, we'll be in a much worse situation. But I think that still, coming back to this test bed or living lab proposal, I think the behaviorals, I mean, policy-wise, we've been talking about mission-based policies, for instance. And it's much easier to put man on the moon as a mission than to do something comparable in scale on the Earth. Because, as we discussed, it requires people to change their routines, the people to change their behaviors. So we've been talking about this mission-based policy, but it's a bit hollow right now. And I think that this is one of the areas that we have to look into more, to include these social scientists, social researchers into policy designing. Well, if Andy says that it takes 90 days to change people's behavior, then there is a chance to do policies that people actually will implement in their daily lives. So short answer to the question, yes, I'm sure we can invest into that, but we have to bring in more competencies from areas that perhaps haven't been included in tech development before.
Definitely. And maybe also include the incentivizing both on the current sick care side and the human, every single individual side, that we are doing this change, behavioral change every day. Joseph, Andy, we're soon to be wrapping up the discussion. What would be your suggestions for Estonian companies, but also for Estonia as a whole? The 2% that the government currently gives is not a big number. How much should that be? And what would be the key things to do from a global perspective?
I think I'll borrow some of Andy's previous answers to try to address it, in that you can't manage what you can't measure. And I think before you can try to tackle the problem, you have to understand the extent of the problem. And so if the answer is going to be multifactorial, do we have the right amount of data to be able to model what a response, or where the pain points, where the easy points are? I mean, there can be some hypotheses, right? If doctors don't want to adopt innovation, why are they not adopting it? Is it because they're too busy? So if that's the case, we have to create more time for them and invest in things to create more time to then get more innovative, to be part of the conversation. Maybe that's one thing. If there was an attempt to document a lot of Estonian genomes, but we know that's only one piece of the equation, do we understand at a population level what the metabolic profiles and metabolic health of Estonians are, what their diets are? Do we understand what their microbiome looks like? Because you know that there's more bugs than us in our own bodies, and we filter the world through our bugs. They're, just throwing random ideas as they pop in my head. I'm sure Andy has a much more structured and systematic approach of trying to address this, but I think you need to first understand. And maybe that involves new technologies and new providers that would allow to do this.
Yeah, so Estonia is a really interesting country. You're absolutely right that it's a great place to pilot things, particularly if you want to pilot them and then take them into the US for sick care. If you want to potentially have Estonia be a place that can really create transformational change, then it's worth just thinking a little bit back into the not too distant past. In the 1990s, this country made an incredible leap into a digital future. And as a result of that, you now punch way above your weight on a global basis. In 1992, this country had no money, no government, no civic institutions, no businesses, no nothing. And we know that because we came here and there was nothing. And today, your GDP per head is more than Japan. That is incredible. Okay, so you are good at leaps of faith. And what I would say is, you pointed out, no sick care minister is going to create healthcare. That's a job for a prime minister. And you have some pretty cool prime ministers here. You've got one right now who I think is pretty effective. And so the first thing is leadership. The big innovation would be for a prime minister to say, we are going to create a healthcare system. That would be the first thing. And the second thing would be to say, we're actually going to allocate capital, not to innovation, because there's plenty of private money doing that very nicely, from a technical perspective. We're going to allocate capital into a healthcare system to create specific financial incentives for consumers to engage in their own health. And we're going to do it at the time when they're probably most interested in roughly their 50s, where we can actually start to use polygenic risk scoring to let you know exactly how much at risk you are for diabetes, dementia, depression, and all the other chronic diseases that may ruin the last third of your life. So that would be, in my view, the innovative prescription that would really differentiate Estonia, and it would be about policy, regulation, and reimbursement. It would not be about the internet and other technologies.
Yeah.
Thanks, Andy. Thanks, Joseph, for that. Sigrid, how would you reflect from the government side?
I would like to see a regulatory sandbox in health tech in the near future to complement what's been already said.
Definitely. The regulatory sandbox is one of the key things that should be there. The clinical one also that came up during the conversation, but very much agree with the panel that the key thing that we actually need is the preventive healthcare system, that we would turn the current system a bit more around than we are. I'm very thankful for everyone who listened to us. I think we took Estonia more towards a global change, step by step. Thank you, Joseph. Thank you, Andrew. Thank you, Sigrid, for giving your very good ideas to every one of us, implementing these in coming days and years. Thank you, everyone.
Thank you.
Thank you.